fear. It doesn't get easier.
At the start of the pandemic,
And I guess in the beginning I was kind of scared.
back in late March and early
Here,
April,
everybody was afraid.
several nurses from Parkland
We
Hospital
need to be cautious, and we need to find out how exactly this spreads.
offered us some very revealing phone
My
interviews,
first thought was, oh my goodness, what if I catch this?
admitting to the struggle, the personal fears, and the mental toll taken by their work with and their loss of patients to COVID-19.
To have a come to Jesus moment with myself and be like, okay, you need to step back and go back to what you usually do.
But more than 7 months into this pandemic, are they back to doing what they usually do?
We cannot let fear control our lives.
This is one of those voices you heard, Parkland nurse Bree Ali.
I've cried once or twice since this pandemic started when I've lost a patient that I've taken care of for a while.
And nurse Chinwe Onogbu, still intubating patients when their lungs begin to fail.
I would say COVID is still a thing. It's still real. People are still getting sick.
And Juliana Rivas Garcia.
I mean, COVID's still out there. It hasn't gone away, and I don't know when it's gonna go away.
Still separating newborns from their moms for 10 days or more when the new mom tests positive for COVID-19.
It's hard to tell a new mom, say, hey, by the way, congratulations, you just had a baby. It's beautiful, but you cannot hold your baby. We have to take baby to make sure the baby's safe and he doesn't get the infection that you have.
The nurses do confirm what the numbers tell us, that difficult moments like these are on the decline, that the rate of infection, the number of COVID patients arriving at places like Parkland has slowed from its most worrisome peak. But they ask us to keep doing the little things, like wearing a mask.
I think if people actually saw the kind of patients that we see every day and how they struggle, I think people will be more willing to wear it. And
Follow the advice of people who are experienced and people who are actually dealing with it on a daily basis.
If we stop wearing masks, washing hands, these numbers can come back up. And that's the last thing that we want. I mean, the last thing that we want to do is to spread things by being careless.
Bree Ali, for one, still refuses to be careless, still not visiting her 86-year-old grandmother in person.
If I don't do those things and something was to happen, I just would feel just terrible for the rest of my life. So.
Life, they ask that now 7 months into this pandemic that we continue to value. They've seen too much struggle, too much death, and would prefer not to have to share all these lessons and face a resurgent virus all over again.
We cannot let fear control our lives.
In Dallas, I'm Kevin Reese.